Hello everyone, I'm Dr. Rajkar Tharad and today I shall be discussing oral care tips for seniors. Aging is inevitable and is associated with various physical, mental and physiological changes along with health issues. As one ages, just like many other self-care activities, good standards of oral hygiene become more and more difficult to achieve. However, science substantiates the fact that oral health is essential and integral to the overall health and is a significant determining factor in a person's quality of life. And so, as you grow older, it's just as important to take care of your oral health as it was when you were a child. So let's begin by discussing some common dental problems that are observed in an aging population. For most of us, loss of a tooth is a trauma. When we lose teeth, the memory of how, why, when and where stays with us long after the tooth fairy has come and gone. Not taking care of your teeth can cause problems at any age. However, as you grow older, these problems can get only worse. Missing or loose teeth can make it very hard for you to talk and eat. As food choices become more and more limited, your nutritional intake as well as eventually your overall health can decline really fast. Difficulty in communicating as well as facial changes due to the missing teeth can impact on your social well-being and interpersonal relationships. Missing teeth also cause drifting of the surrounding teeth, so much so that they create areas around your gum line which can trap bacteria in food and create an ideal environment for gum infections to begin. In order to prevent all this, you can get replacements for the missing teeth in the form of partial or complete dentures, which will help to improve your chewing efficiency and nutrient intake as well as prevent drifting of teeth. Research shows that the rate of tooth decay in people over the age of 65 outpaces even that of school children. And adults who have grown up before the advent of fluorides or preventive oral care have fillings from their childhood and adolescence which eventually break down, and dental decay can easily begin below these broken fillings or leaky margins, and if left undetected can progress on to involve the tooth bulb. The nerves at the center of this tooth bulb lose their sensitivity with age, and so the problem may be well advanced before you notice any pain. You may even need a root canal treatment at this point. The upside being that a procedure like this, which may have caused discomfort when you were younger, will hurt a lot less now that you are older because of reduced nerve sensitivity. This kind of decay can be easily detected with routine radiographs that are taken during regular dental visits. Gums naturally recede with age and cause the root surface of the tooth to be exposed to the oral environment. The root surface of the tooth is softer than the crown portion and hence more susceptible to dental decay. In severe cases, root decay can also lead to the fracture of the neck of the crown, which is the portion of the tooth adjacent to the gum line. Fluorides present in toothpaste, mouth rinses, as well as dental professional treatments like fluoride varnishes as well as mouth gels can help to halt the progression of root decay as well as reverse the damage in some cases. You may have also noticed that your once bright sparkling smile has dimmed over the years. This is partly because of the wearing of enamel caused due to years of grinding, gnawing and crunching as well as exposure to acidic foods in the form of citrus fruits as well as carbonated beverages. Wearing away of enamel causes the natural yellowish dentine layer which is beneath the enamel to show up. Also, because of aging, more dentine is laid down by the tooth and so the pulp chamber becomes smaller and the tooth loses its translucency and appears darker. Also, the enamel itself can get stained because of coffee, tea, red wine as well as tobacco. There are a lot of dental whitening products available in the market which you can try. Those dental products which contain peroxide can help to lighten your teeth by a few shades. However, dramatic results are not generally seen in older teeth. Whitening toothpaste as well as mouth rinses can temporarily lift superficial stains but do not expect the results to last for too long. You can also take professional advice regarding the bleaching products or professional bleaching, as some of the dental whitening products contain carbamide peroxide and hydrogen peroxide which may cause sensitivity of the teeth. You can also try some natural remedies like a mixture of baking soda and lemon juice, or salt and lemon juice, or a toothpaste containing enzymes, fruit enzymes from papaya and pineapple. Forget about Botox, fillers and pricey anti-aging creams. If you really want to turn back the clock, then looking after your smile is the simplest and the least painful way of doing so. Research shows that a healthy and bright smile can make you look at least 5 years younger. Teeth are amazingly strong, but they're not indestructible. You can do only so much to prevent the natural wear and tear of your teeth, and so the pillars of oral care remain the same for any age and include regular visits to your dental office and a diligent oral home care routine, which includes brushing your teeth with a soft toothbrush and a toothpaste that contains fluoride in the ratio of 1000 parts per million. If you have a caries-prone mouth, your dentist could recommend a toothpaste which contains 5000 parts per million of fluoride. Ideally, I would recommend brushing your teeth after every meal when possible. However, since you don't want to make a profession out of it, aim for at least twice a day, and you should be flossing your teeth once a day, preferably at night. For those adults who have difficulty in brushing because of health issues like arthritis, try to go for an electric toothbrush or speak to your dental healthcare providers about the use of special aids as well as dental cleaning aids like water flossers. Try to have a diet which is low in sugars and high in fibers. These actions will help to keep your mouth young as you age. I hope these tips are of help to you. Stay tuned for more information on dry mouth, denture care, and lots more in my next videos. There's a saying, growing old is mandatory, but growing up is optional. Whichever path you choose, stay healthy, stay happy. In the meantime, keep smiling and namaste.